Hi, I'm Dr. Steve Grinstead, developer of the addiction-free pain management system. Today I was on a phone call with a patient who lives in a different part of the country on the East Coast. This person has had a history of major pain since 2007. He's been to a lot of different doctors, been to places like the Mayo Clinic and other prestigious places to be assessed, and unfortunately no one is really coming up with why his pain continues. A year or so ago, he started using alcohol to self-medicate and started getting in problems. Well, this person really needs a different approach. And the best practice standards say people living with chronic pain lasting more than 6 months, should be offered integrated pain management. What I mean by that is a multidisciplinary team approach needs to be put into place. There needs to be input from the medical professionals, the doctors, the nurses, the physician assistants, the nurse practitioners, etc. And there needs to be diagnostics done. And this has been done in his case, and they cannot really determine exactly what is generating and keeping this pain going after a surgery that he had in 2007. So the next step that I'm going to work with this gentleman on is to do an assessment for the psychological emotional part of the pain, to explore if he's experiencing any other co-occurring problems, and to really address the using alcohol to self-medicate, because that might be part of the problem right there. I'm working in collaboration with my Addiction-Free Pain Management Center of Excellence, Valley Forge Medical Center in Norristown, Pennsylvania. At Valley Forge, they've integrated my system into their hospital setting, and they've had great outcome success with people. This particular person's been there a couple of times, but just for detox. This time, as I do the assessment with him, coming up in a day or so, I'm going to really recommend that he go in and give this program an honest try and learn some new tools. It's really important that people stop depending solely on medication for chronic pain management. Yes, in some cases they may need a medication intervention. I'm not against medications. I don't think there's anything wrong with a lot of the medications. However, sometimes I think it is wrong when the wrong medication is prescribed or the right medication is prescribed to the wrong person. What I mean by that is someone who has a history or family history of a substance use disorder or any mental health issues. We need to use extreme caution about what we use in this case. The other thing is to help people differentiate between pain and suffering. The Synergistic treatment system that I developed and have helped implement at Valley Forge Medical Center does just this. They meet the person where they're at. They use a team approach, use a psychiatrist, internal medicine, a DO. They have nurses on staff 24/7, and then they have the clinical team with addiction specialists, social workers, and other mental health specialists like marriage and family therapists. They get the family members involved whenever possible. Positive family support is one of the best indicators for healthy outcomes for this population. So it takes a team to heal a chronic pain patient. And if you don't have a team, if you or someone you love is living with chronic pain, the first step is to get a team built up. And also to remember there's a big difference between pain and suffering. When I work with people, that's one of the first things I help them see. And that is what Kelly Driscoll, the primary therapist for the pain program at Valley Forge, is really good at. I've trained Kelly to really help people see how they can learn different ways to manage those types of pain and turn the pain system down. I call the psychological emotional symptoms the amplifier circuit. So we want to teach patients to turn the amplifier down. And it's very doable. It takes a lot of willingness, a lot of motivation, and it takes a team. And so if someone you know or someone you love is living with chronic pain, please share this video with them. If you're watching this on YouTube, go below and check out the link to my personal and professional blog sites. On the professional site, you're going to hear the rest of the story about using an integrated team approach for this population. On my personal blog site, you'll get to hear how some of my successes and struggles with my own chronic pain have played out. And remember, freedom from suffering is everyone's right, and it's also a responsibility. So be responsible, learn as much as you can, and please share this information with people that need it. Thanks.